Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon and founder of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a trend that I think is actually quite huge that is going to be seen a lot more in 2023. And this is a facial rejuvenation trend that is going to start to gain speed and momentum in 2023. And that is, we're seeing younger patients. And when I say younger, I'm talking about patients in their early 40s and even late 30s who are having facial rejuvenation surgeries instead of having non-surgical procedures over and over again. And to explore this topic, I'm going to go through 3 reasons why this trend is starting to gain speed. And hopefully by the end of it, you'll have a better understanding, especially if you're in that position, or if you're not, it'll make a lot of sense for any stage of aging that you're in, and a lot of good information coming your way. So without further ado, let's break it down. Let's talk about why we are seeing this trend. So let's talk a little history for a second. What we have been doing for the last 20 years is splitting the aging face patients into 2 separate categories. Category number 1, the obvious surgical candidate. Somebody who's in their late 50s, mid 60s, sagging, jowling, laxity in their neck, eyes, bags, the whole 9 yards. That patient, clear decision, go get a facelift. The next category of people were the younger group. The younger group meaning people in their 40s, early 50s, and even sometimes in their 30s. I'm going to talk about that in a moment. And those folks were thinking, God, you're too young to have surgery, right? You got a long life ahead of you. Why start so young? Let's try a lot of non-surgical things. So we put those patients into that category. 20 years ago, this was a very clear split. Prior to that, we literally didn't have any treatments to offer to a younger patient. So it was basically like, just wait till you're old enough to get a facelift. In between now and then, you're on your own. But then we started getting all sorts of different treatments available. So we started throwing these at the younger group. And what we have seen after the 20 years is going to form the basis of the conversation that follows. But before we do, let's set up a definition of what it is to have facial aging and what does facial aging look like? Because I think there's a lot of confusion about this. So what facial aging fundamentally is 3 different changes that are happening simultaneously to the face at the same time. The 3 changes are, number 1, there's skin changes. And I'm gonna come back to this in a moment. Number 2 is loss of volume. Number 3 is laxity. When we think about a young person, any image that comes to mind is typically somebody who's in their 20s or early 30s. And what are the characteristics of that young person? Characteristic number 1 is they have youthful, beautiful, supple, thick, bright-looking skin. Number 1. Number 2, they have generally good volume, meaning that they don't have a bunch of hollows and concavities and areas of depression on their face. So they have good volume, they look healthy, and as a result, generally speaking, look less tired, and overall it's consistent with a younger looking face. The third is sagging. When you think about a young person in your mind, you don't see sagging. Jawline is firm, neck is firm, cheeks are up where they should be, eyebrows are up where they should be, eyelids don't have a bunch of extra skin or bags. Everything is up. And we think about this from a shape point of view as like a heart or an upside down triangle, right? That's youth. What happens with aging? All 3 of those things are being affected. Skin becomes more dull, it becomes more crepey, gets more pigmentation, it loses that suppleness, gets more pores. Those are skin changes. Then we look at volume. Volume starts to diminish in critical areas like underneath the eyes, above the eyes, the temples, around the mouth, the lips, all start to deflate a little bit. That's a fat loss phenomenon. Notice I didn't say the cheeks, just to be clear. Then there's sagging. There's a change in facial shape. You start to see tissue that is starting to come down, heaviness along the jawline, heaviness along the neck, mid-face starts to creep down and the nasolabial folds get thicker, corners of the brow starts to descend and gets crowding around the eyes. All in all, when you take all that together, you start to see a face that is more rectangular shaped, right? Or if you want to use the triangle analogy, instead of the triangle being narrow at the bottom, you start to get narrow up top, thick at the bottom, right? The base is at the bottom. So those changes, volume loss and laxity, are what make up facial shape. And no matter what stage of the chronological aging continuum you are, if you feel young on the inside and you look in the mirror, take a photo and you look aged, there's a disconnect there. And that disconnect is what doesn't feel good. That disconnect is what drives people to want to treat it, right? People don't just show up at med spas or dermatology practices or plastic surgery practices just for the sake of it. They're coming because they see something in themselves. And that thing that they're seeing is either accumulation of those three things that we just talked about, or more specifically, it's the changes in facial shape and volume that is the underlying reason or current for people to seek any type of assistance with the aging process in hopes of defying it, restoring it, etc. Okay, so now that brings us to the second reason that this is all happening. So what have people been doing with this, awareness, with these opportunities that non-surgical treatments have afforded us? What's been the course of action? Well, we said the older patients, clear cut, go get surgery. Younger patients, 30s, 40s, and even early 50s, we've treated them as, you're categorically a little too young to have surgery. So let's go ahead and use the tools in our toolbox, the non-surgical tools in our toolbox. So what are those tools? Fillers came on the scene and gradually started to have greater and greater indications. Remember when they first came on, it was just about the nasolabial fold. Then later on, they became, cheek fillers, and they became fillers under the eyes. They became a number of, now you can use fillers for, throughout the entire face, and there's like tons of different varieties of them with different consistencies, etc. Then there was threads, right? String lifts and thread lifts. And then there's the technology-based stuff, the radiofrequency, the ultherapy, the thermage, the profound, all these different categories of what we lump up together and call them energy devices. So here's how the story would go. You're in your late 30s, you're starting to see a little bit of heaviness along the jawline, maybe even a little bit of sagging in your neck, call it 30s, early 40s. And you go in, here's what happens. You get some filler in your cheek, maybe in your temple, fillers around the mouth and jawline. You might get a round or two of Kybella for the little bit of fullness in your neck. You might say, yeah, I'm gonna try some ultherapy. The ultherapy is supposed to, build collagen, tighten things up, but I need several treatments, so you get several treatments done. And you're doing this, month after month, year after year, and before you know it, your 5 years have gone by, 10 years have gone by, and you're doing this sort of cycle of treatments. And what ends up happening is, through all of that, we have been seeing two fundamental observations after about 20 years. And I did a whole video on this just recently. And I urge you to watch it, and it goes into a lot of detail about that. But what we've seen is that, in a nutshell, fillers don't completely go away. So as a result, the face starts to deform, starts to form new shapes that it didn't have when we were in our 20s and 30s. Because remember, at the end of the day, the goal is to look like we used to. So now suddenly we're getting fillers repetitively done in our cheeks and our jawlines, and our face is starting to get bigger and bigger and heavier. And as we're aging, these changes continue to happen, right? Laxity continues to happen. And this is where it gets tricky, because as the changes start to happen, your dependency on the fillers and the dependency on the treatments starts to go up. So you add more filler, go in more frequently, do these treatments a little bit more often. And as a result of that, what you start to see is, after 10 years, the face is very unusual looking, right? I mean, we see it all the time, unfortunately. We see the effects of puffy face and pillow face and all these different terms that have come up as a point for us to understand what it looks like when you have too much filler. But this is why that cycle happens. String lips, they last 3 to 6 months, right? The thread lips. You're doing them repetitively, like twice a year, 3 times a year, to try to hold everything up. But as the tissues continue to age, they get harder and harder to hold up, and so on and so forth. I mean, you can see, the cycle basically becomes full force on these treatments, while the aging process is continuing to escalate and accelerate. And so now you find yourself, you started the process in your 40s, now you're in your 50s or early 50s, whatever it is, and you're like, okay, I guess I'm getting to that age now when I need to have surgery. But this is what the people are seeing now. They're recognizing that those treatments that just mentioned, not only do they not slow the aging process down, but they have the opportunity to create complication and create changes in the facial shape and things that even after surgery are difficult to address, meaning that your face can actually look permanently different as a result of too much filler being placed for over a 10-year period, for example. So the younger patients, the ones who are just entering this stage, are recognizing that perhaps this is not the most effective and efficient way to go. So when they see the opportunities to have a natural looking correction of their face, because that's again another huge reason why people avoid surgery is because they don't want to look unnatural. And I think, and I'm just speaking for our practice, and I know there's a number of other ones out there, if you do the procedures properly in the right approach and the right vectors and the right experience of the surgeons, etc., you can look very, very natural, basically unoperated looking, and get all these things corrected. And that's, at the end of the day, what people fundamentally want. No one's choosing a temporary or ineffective treatment because, that's just better. They just think that that's the only thing that should have been done, at that stage because it's too young, or they just don't want to look weird as a result of surgery. So what we're seeing now is people are looking at, for example, I'm just saying like an Instagram feed like mine, or watching videos like this, and they're looking at these before and afters and seeing faces looking natural and fully restored and corrected. And then they're saying, all right, I'm gonna look into this. And then they look into it and they realize, it's a pretty good all around option. And instead of going through 10 years of this sort of cycling and this sort of thing, they're jumping right into the surgical treatments. But here's an important factor in this reality is, the people who have always been doing the non-surgical treatments at a younger age are people who had changes in their faces that were consistent with aging at a younger age, right? Again, back to the first principle, like who would, with a completely youthful looking face, go in and get a bunch of treatments done? I mean, what injector or what, doctor would even tell them that that's okay to do that? No one would. They would say, hey, you look like you don't need anything, go, off you go. But the person who's actually coming in and then getting treatment probably has some changes in their face that are consistent with aging. And I think what people ultimately want is they want that youthful facial shape, and they want it now. And they want to effectively get there. So that's really what the issue is. And what I think what we're seeing is that there's always been a continuum of anatomic facial aging changes. And I see this with people who consult with me all the time, where they might be in their 40s, but yeah, they've got heaviness along their jawline. They've got a little bit of laxity along their neck, or maybe a lot of laxity under their neck. And so genetically, these folks are aging before the rest of the bell-shaped curve is, right? That bell-shaped curve is like late 40s, early 50s. They're starting to see these changes happening. Everyone else, we assume, doesn't see any aging until that point happens. But the reality is, there are people that are starting to see those aging changes earlier, and those are the people that are now saying, you know what? I'm gonna go in and get a vertical restore done or a vertical prevent done and get a fat transfer and address my facial shape and literally go on and enjoy my life. And not have to think about, in 3 months from now I have to go in for another filler, or 6 months from now I have to go in for another treatment, and then have this like lifestyle, anti-aging lifestyle carry on with them. Not to mention the cumulative expense and time that goes into that type of an approach. So this past year, and we're seeing this momentum build, we're just seeing a lot more people saying, forget it, I'm not even going that route. I'm not picking the non-surgical option. I'm going straight to surgery. And personally, I don't see anything wrong with that, because obviously it's a personal decision you have to make. You have to know the pros and cons of all of this. But if you want ultimately to look as young as you feel, which is the same principle that guides anyone at any age to seek these treatments, then if we got a better treatment that gets you there quicker and more effectively, then do it. And then another question that comes up, I think, and you might be thinking this, well, if you have a surgery done in your 40s, well, what about your subsequent surgery? Aren't you going to kind of burn out on that end? Well, the reality is, if it's a properly done lift, like the vertical restore, it's based off the deep plane. It's a very effective and durable change. We're talking 10, 15, sometimes even potentially longer where somebody wouldn't need to do anything surgical again. Fat transfers, permanent. You don't need to refill constantly. So that's the concept that's going into this. And those are the decisions that I think people are making as they're moving forward and making the decisions that they're making, and why more and more and more people are skipping the non-surgical treatments for the surgical approaches. And I think if you're watching this, at any age, this is important to know, but here's what I would say. The reality is surgery is not completely affordable for everyone, right? It might take planning, et cetera. So what I would say to that is this, and this is the note I'll leave you on. The thing that you can work on, which will be very meaningful, is working on your skin. Because if you're preventing your skin from aging by being protective with the sun and using the right active ingredients and all that kind of stuff, what you'll start to see is your skin will literally either not age or get better and better with age. That's an incredibly important place to place your time, energy, and investment into, because that is what you control. Then when the time comes and those other things happen, well, whatever time is right for you, you choose the surgical option. If you can't do the surgical option, well, at least you're doing something that's effective and you're not wasting time and money on things that are not going to necessarily improve situations, but also could end up hurting you. So that's kind of the focus. I would say anyone at any age focuses on skin, and then you make a decision how you want to approach it. Now, I want to qualify everything I said with small amounts of filler in early aging changes can have very meaningful effects. It's just that when the aging changes are real, like there's actual laxity and the facial shape has changed, don't expect or try to do those with fillers, because you're going to go down a road that's very non-anatomic and very unusual looking. All right, folks, I hope this helped shed light on what I think is going to be a continued and big trend in 2023 and beyond: younger patients seeking surgical treatments as opposed to non-surgical. If you have any questions about this whatsoever, drop them in the comments below. I will do my best to answer them. If you haven't already, hit subscribe, follow along, share this with some friends and family, share this with whoever you can. I love educating. I love sharing my perspectives and observations. If you don't agree with it, that's okay too. Drop them in the comments if you want more clarification on the perspective. All right, everyone, thanks so much. Until next time, Dr. Amir Karam.